Hello, this is the Chapter 31 lecture of the renal system. This begins on page 524 of the textbook. Figure 31.1 diagrams the renal system, showing you the connective tissue capsule, the coiled kidney tubule, simple epithelial lining, blood vessels. We get a closer look at the kidney, ureter, bladder, urethra. The bladder itself, we take a look at the connective tissue capsule, smooth muscle layers, transitional epithelium, and this is found on page 525 in the text. Anatomy and physiology of the renal system, again beginning on page 525 of the text. The renal system consists of two kidneys, two ureters, one bladder, one urethra. The kidneys are located in the posterior abdomen, posterior meaning the back, just above the waist. Renal system organs are responsible for filtration of waste from the blood, removal of urine from the body, maintenance of water balance, maintenance of electrolyte balance, maintenance of acid-base balance. And that was the bullet points that started on 525 and continued to page 526. So there on page 526, a closer look at the kidney. Again, we have two. The kidneys filter blood and remove waste. They control body fluid balance and regulate the body's balance of electrolytes. They make urine. Loses about 90% function when the body experiences various problems, diseases, or conditions. The nephron, still on page 526. The nephron is the smallest, most basic part of the kidney. Filters the blood that passes through the kidneys, produces urine through the process of filtration, reabsorption, and secretion, enables blood to reabsorb water, electrolytes, and nutrients. Table 31.1 details the actions of selected substances in the nephron. This is found on page 527 of the text. So water, the mechanism is detailed as reabsorbed by PCT and collecting ducts. Comments creates osmotic gradient. Sodium, hydrogen positive ions, potassium positive, chloride negative, antidiuretic hormone, so on and so forth. I will let you look through those details at your leisure. And again, as always, do not discount these tables, the workplace wisdom boxes, the info boxes. There's good information in those boxes, and they're designed that way to try to pull your eye to them. So next, we're going to look at the bladder and urine. This begins at the bottom right of page 526 and very quickly carries over to page 527. The average adult bladder has a capacity of about 350 to 500 milliliters of urine. Around 250 milliliters of urine triggers the urge to void, or the sensation that, hey, it's time to go. Again, pay attention to these numbers. You will need them later. Micturition reflex is a relaxation of sphincter in response to increased pressure in the bladder. Normal urine color ranges from clear to dark yellow, can be affected by different foods. Before I continue on into renal failure, I also want to point out on page 527, there are some bullet points that point out some variants in color of urine that are called and what it's caused by. So some foods and medication that can produce great variations in urine color, such as beets, blackberries, rifampin, and some anticoagulants can cause the urine to turn red. The urine can turn orange when a patient takes a product called phenazopyridine. That product is used in conjunction with UTIs. It helps relieve some of the pain and discomfort of having the urinary tract infection. Green or blue urine is produced by amitriptyline, which is a drug that is used. The patient generally would take it at bedtime. It helps. It's not quite like a Xanax, but it does have some calming effects and some other benefits. And vitamin B complex can also cause urine to turn green or blue. Brown or black urine is produced by a medication called levodopa and or iron products. So just be aware of that. Now moving on into diseases, conditions, and treatments of the urinary system. So first we're going to look at renal failure. This is page 527. This is described as complete kidney failure. So a deadly buildup of waste products, balance sodium, water, and vital electrolytes would back up into the body. This is going to require immediate treatment, usually through dialysis. Table 31.2 is found on page 528 in the textbook. It details pharmaceutical treatments for renal failure. I'm not going to go through this list, but I highly suggest that you do. You need to be familiar with these things as a pharmacy technician. Again, you need to at least have a basic knowledge of what these medications are treating. And unlike their over-the-counter products, these prescription medications do not have the details of what it is for readily available on the bottle itself. You would have to pull up the patient insert, or the package insert rather, and read through that information if you did not readily already know. So that is why we cover this material, so that you will be aware of it. Prostatitis, I'm guessing is, and I'm probably, yeah, prostatitis. This is a common condition in males. Forgive me for my enunciation issue there. Many uncomfortable symptoms come with this, such as urges to urinate, urination pain, fever, chills, sexual problems, and pelvic pain. Treatment may include surgery and or medications such as antibiotics, anti-inflammatory drugs, and alpha blocker medications. Urinary incontinence. This is the inability of the body to hold urine. So there are types of urinary incontinence, such as stress incontinence, which is leakage occurs during exercise, coughing, or laughing. Urge incontinence, also known as overactive bladder. The person has little bladder control, especially when hearing running water, drinking, or sleeping. Overflow incontinence occurs when a person cannot completely empty the bladder and there is a constant leakage. Functional incontinence occurs when a person is not able to get to the toilet in time because of mobility limitations. Functional incontinence is the most common form of incontinence in older patients. On page 528, mixed incontinence. When a person has more than one form of incontinence, which may or may not be related. Anatomic incontinence occurs when a person has a physical abnormality, and temporary incontinence may be due to urinary infection or severe constipation, or occur as a side effect of certain medications. So some common causes of incontinence include childbirth, obesity, hysterectomy, recurrent bladder infections, certain medical conditions, and certain drugs. It also notates in our textbook that hysterectomy alone increases the risk of incontinence by 30 to 40%. Be aware of that, ladies. So treatment depends on the cause. Kegel exercises may be beneficial in controlling urine leakage. They help improve the muscles of the pelvic floor, thereby improving the urethral sphincter tone and function. Alpha adrenergic blockers, adrenergic antagonist drugs, alpha adrenergic antagonist drugs And we also have estrogen replacement therapy, which is controversial. Urinary retention. This is the inability to urinate. I'm on page 529 in the textbook. Bladder is not able to release urine despite the urge. This is more common in men. And common causes include blockage or obstruction of the urethra, benign prostatic hypertrophy, disruption or damage to nerves that connect urinary tract with the brain, pelvic infection, anesthetic effects during or after surgery, and other drugs that tighten uterus and block or restrict urine flow. So treatments for urinary retention include insertion of a Foley catheter. Antibiotics may be used to avoid or treat urinary tract infection. Urinary cholinergics can be used to treat non-functional incontinence in post-operative and postpartum patients. Bacterial infections of the urinary system. Symptoms would include frequent urge to void, burning sensation when voiding, cloudy or strong smelling urine, and blood in the urine. Most common is cystitis and pyelonephritis. Treatment includes cranberry juice, keeps infection causing bacteria from attaching to the walls of the urethra and makes urine more acidic. Anti-infectives that destroy or inhibit bacterial growth, and phenazopyridine, 200 milligrams, 3 times a day after meals, can be used to manage the symptoms of a burning and itching urethra. Anuria, and I'm on page 530. This is the production or excretion of less than 100 milliliters of urine per day. If wastes are not eliminated from the body, the person may die from toxemia or septicemia. Dysuria is difficult or painful urination. Hematuria is blood in the urine, possibly from an injured kidney or infection. Nephritis is inflammation of the nephron that causes the tissue of the whole kidney to become inflamed, usually due to infection. Oliguria is decreased urine production, only 100 to 400 mLs per day. Pyuria is pus or bacteria in the urine, and uremia, urine in the blood. Kidney stones. These are common and painful urinary tract disorder. Solid mineral deposits accumulate in the urinary tract. Treatment can be palliative. Oral analgesics for mild to moderate pain may be used, or preventative mineral and vitamin supplements and increased fluid intake. Table 31.5 is found on page 532. Details the pharmaceutical treatments for kidney stones. Edema and hypertension. This is kidney damage can lead to hypertension, which can lead to kidney failure. Kidney failure can lead to excess fluid in the body, peripheral edema, and ascites. Excess fluid places excessive workload on the heart, raising blood pressure, leading to heart failure or myocardial infarction. Treatment would include diuretics to reduce high blood pressure because they reduce the volume of fluid in the body and in the blood. Table 31.6 on page 533 details pharmaceutical treatments for edema. And edema, again, is the swelling because of excess fluid. Diabetes mellitus, page 533. Diabetes mellitus and the kidneys. So diabetes can cause diabetic kidney disease or diabetic nephropathy. End-stage renal disease, ESRD, requiring dialysis or a kidney transplant. Warning sign is protein in the urine. Risk factors, familial end-stage renal disease, diet, high blood pressure, high blood glucose, and non-compliance. Diuretics begins at the bottom right of page 533 and very quickly goes over to page 534. These increase urine output in various ways. Most diuretics inhibit or block sodium absorption in the nephron. They play a significant role in the renal and cardiovascular systems. So in summary, on page 534, proper functioning of renal system is essential to maintain life. 2 kidneys, 2 ureters, 1 bladder, 1 urethra. The renal system filters waste from blood and removes it from the body, maintains water and electrolyte balance, and maintains acid-base balance. Again, as always, if there's anything that you didn't quite fully understand, please reach out and we will work through it. Until we see each other again, bye-bye for now.